people, you're welcome to another episode of Nursing with Abby. Today we are going to be talking about breast engorgement. Yes, breast engorgement. I know quite a number of experienced mothers have gone through this, and sincerely it is not a kid's play. A lot of pain is experienced with this condition, and a large number of women experience this. So we want to talk about this. We want to get down to business. We want to discuss it. We want to find ways to avoid them, and if you have them, what to do. But before we go into today's episode, I'd like to thank all of my subscribers. I really need to thank you because we are really growing large. Thank you so much for the love. Thank you for the support. Thank you for the encouragement. Thank you so much for making this happen. You are always supporting me, and that's why I just love keep churning out more valuable nursing content. Thank you so much. I appreciate. Now, if this is your first time of watching me, my name is Nurse Abiodun. I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. Now, on this channel, I always talk about nursing, I talk about lifestyle, and I talk about everything in between. So today, we are going to pick one of the topic from our Antenatal and Motherhood series. Believe you me, we are already hitting the 20th series. Yes, we are almost close to the 20th series, and I need to thank you all for that. So I will keep on going. Now, today we are going to be talking about breast engorgement. But before we go into that, please make sure you like. Yeah, you can just do that now. Like, and just press that red subscribe button over there. That subscribe is free. Please subscribe, and then a comment. I would love to read your comments. I would love to read your comments to hear what you have to say, and then how we can get better also. So, moving right to the discussion for today, breast engorgement. Now, it's that painful feeling in your breast, and definitely it's after delivery of your baby or babies. Yes, it could either be normal delivery or CS, really doesn't matter. As long as you deliver the baby, you carry the pregnancy for whatever the number of months, 9 months, and you deliver the baby, you are at risk of breast engorgement. So breast engorgement is the development of the hard, swollen, and painful breast when too much breast milk accumulates in the milk ducts or the breast. Yes, just put it like that. So too much milk accumulates in the breast, and it's difficult finding its way out, and that's breast engorgement. And they become extremely tight, painful, lumpy, tender, and really discomforting. And that's what really triggers a lot of women off with breast engorgement, because initially they might even not breastfeed within the first 2 days of delivery, and then by the third day that the breast milk starts to come out, instead of it coming out directly outside through the nipple, it will just store in the breast, and then it will be causing a lot of pain. Some women even complain of fever, chills, and rigor. So you may even feel swelling even right to your armpits. Yes, it's as serious as that. It will be so hard and heavy and painful that it can even cause insomnia, and you feel so sick, so frustrated you can't even take care of your baby. And remember, the baby is crying for food, and you are also crying due to engorgement. So you can see that both mother and baby are crying for one same condition. So it needs to be avoided. So what do we do? Now, normally, like I said, some people might not lactate. That means that they may not start bringing out breast milk immediately after delivery. Some, it might take a few days before the breast milk starts to form. The hormonal influence that happens along that line, I don't want to bore you with that. But importantly, the breast milk later start coming, and if you have not prepared your breast before delivery, it might give us a lot of issues even at this point, especially your nipples. Now, if your nipples are they are not so clean, or they are not protruded out or prominent or pointed out, then there could be a problem. That means that your breast will be full with breast milk, and the passage, which is the nipple, is blocked, or it's not pointed enough for the baby to be able to grasp his mouth on the nipple and latch on the breast to suck. And then poor positioning also, when you don't even know what to position. You don't know what the mouth of the baby should latch on. The mouth of your baby should not latch on your nipple, because it's going to make your nipple very sore, painful, and cracked. Your baby should latch on the areola, which is that round surface, that round center, that round circle, yes, around your nipple. That's it. That's the areola. Now your baby is supposed to put the better part of the areola in his or her mouth. So the baby is able to suck the milk duct, which is on the areola, instead of sucking on the nipple, which is going to cause a lot of pain and crackling of the nipple. So that's even aside that. But what we are really talking about is breast engorgement. Now, why does it happen? Like I said, when there is increased blood flow, your body is already regulating, telling your body system that you have to breastfeed. So there is increased blood flow to your breast, which will produce more milk, and then your breast will be filled up. Number two, the milk production, like I said, is synthesized by your body system. So it makes your body realize that, okay, a baby is here and we need to feed the baby. How much, how little, they don't know, but they just know they have to fill the breast with milk. Now, most first timers do have difficulty with having to, prepare yourself physically and emotionally to latch the baby on breast appropriately. And that is why I explained that your baby should not grasp its mouth on the nipple, but on the areola. And then the nipple should be at least at the upper palate of the baby's mouth. Now, the baby might be yet to suck as much. Some babies do not really suck that much. And we do have situations of mothers who probably were not strong enough to breastfeed initially, and the baby was introduced to infant formula to prevent the baby from starving, while the mother was still trying to get herself together. Now, by the time the mother is ready to breastfeed, the child probably will have been so used to the formula that the mother, it might be difficult having to latch the baby on breast. So that could also be a factor. We try as much as possible as health professionals, even if it was through surgery, that the baby should be put to breast. But there are some conditions, like I said, that may require that the baby, maybe a woman who had eclampsia in pregnancy, and even during a delivery, she's still yet to come around. She might not be able to breastfeed adequately, and we might need to give formula to the baby through cup and spoon while the mother recovers or gets better. So within that time, the child probably will have been used to infant formula, and then we have to do a lot of work latching the baby to the mother's breast. Now, so what can we do? There's a problem, and definitely there must be a solution. Now, it's important to plan your schedule. How many times do you want to breastfeed your baby? You can't say you breastfeed your baby 3 times and you don't have breast engorgement. At least 8 times in a day, 3 hours interval, and it should be round the clock, so that you ensure that as the milk is filled, the baby sucks. The milk is filled, the baby sucks. Okay, and that is very important. Then you can try to empty your breast, even if the baby was not able to suckle on both at the same time. Normally, what you're supposed to do is put the baby on both breasts at the same feeding. Okay, but it's possible that maybe the baby took something else, maybe took formula or something, and then just one breast, the baby is okay. The other breast will definitely be filled before the next feeding time. So you can do well to use warm compress to express the breast milk out. You could even express into a clean container and top feed your baby maybe in the next 1 or 2 hours. At least your baby is still getting something while you are also recovering. All right, you could also resist the temptation of breastfeeding while lying down. Yes, this has been shown through research that it can increase the risk of children having otitis problem, that's ear problem, because there's a connection between your mouth, your nose, and your ear. So when the baby is being breastfed while lying down, it could increase the risk of inflammation to the ear. So please try as much as possible to try and sit up, or at least let the baby be in almost upright, sliding position, or sliding position, or if it's having to sit, but instead of the baby's ear to be on the ground while you also lie down breastfeed, that is not a very, very good position. Please ensure that. I know it's a bit a lot for a lot of women that they feel very comfortable having to breastfeed while lying down, but please, even if it means having to raise the head of the baby up a little, please, it's very important. Now, like I said, breastfeed at least 8 times in a day. Then do more of breastfeeding, much more of breastfeeding than bottle feeding. In fact, we do not advise bottle feeding at all. It should be exclusive breastfeeding for 6 months, and then you start giving other meals gradually till 1.5 years. Now, you can also use warm compress, like I said. Practice stop feeding. Then you can use paracetamol for the pain, because sometimes it's a lot of pain. So you can use paracetamol for the pain, or some people suggest ibuprofen, which is not definitely good for asthmatic patients. So but paracetamol is still okay. Then you can wear a snug but supportive bra, which can help. Then if you rest well, it also helps. Now, what are the complications of this condition? Now, some people say it causes overactive letdown reflex. Now, when your breast is too full and your baby wants to suckle on it, because there's too much milk being produced at the same time, especially for a woman whose breast, the nipple is protruded or something, or prominent, the baby starts to take much more breast milk than the baby can swallow, and it can cause the baby to gag, it can cause the baby to choke, or even swallow excessive air as they try to latch on the breast milk and the breast, and then take the milk. So it is important that you take it slow with the baby, even if it means having to express your breast a little out, and then so that the baby can the breast milk and then the baby can be at the same tempo. Okay, then it can cause mastitis, which is inflammation of the breast. When it becomes too hard and start to collect together, forming some kind of abscesses, that is a serious problem. Then it could cause frustration for both the mother and the baby. The baby is crying, the mother is crying. The baby is crying for hunger, the mother is crying for engorgement. So please, let's prevent that. Then sore and broken nipple. Like I said before, the baby is not latching well, or your breast is too engorged, or you're frustrated, definitely the baby just latches on the nipple alone and not the areola, and can cause sore or cracked nipple. Then blocked ducts, like I said, that's the same thing. And then it reduces milk production, because by the time your breast is too full, there will be sensation sent to your brain that okay, it's enough, maybe she no longer wants to breastfeed, and then this will stop. That's what happens when you finally want to take your baby off breast milk. The breast keeps filling and there's no let out. The brain synthesizes your body that okay, let's stop breastfeeding. I think she doesn't want to breastfeed anymore, and everything goes back and it gets dry. It just takes a few days, but it will still happen. There will be no breast milk throughout that time until maybe later you have another child. So that's what really happens. So that's what we have concerning breast engorgement. Please share your story with me. I had breast engorgement also with my first baby, and it wasn't a pleasant experience. While I tried to shy away from breastfeeding, I was told that the more you shy away from breastfeeding, the more the breast engorgement increases. So I had to bear the pain, and still kept breastfeeding even with my nipples almost cracked out. It was really painful, but that's what a mother does. So thank you so much for another episode of Nursing with Abby. I would appreciate your questions. I'd appreciate your queries, even your contributions, and I'd love to have another beautiful time with you. Till I see you in my next episode, please ensure you like, share, and subscribe. Thank you so much. It's bye for now.